Hi, friends and colleagues. I am Oscar Ramon. I am a dentist and I work with prosthodontics and dental implants. I would like to say thank you to Cortex China for this nice invitation to share knowledge with you. I live in Colombia in South America and I've been working with Cortex dental implant for more than 10 years with excellent results. I live in Medellin, a nice city, is the second largest city in Colombia. And I work for the National University, for the University of Antioquia in Medellin, Colombia, is the second largest public university in my country. I work as a professor in the dental program. Today we are going to talk about conical connection implants. In the first part, I will do an introduction to conical connection implants. Then we will talk about indications and protocols using Cortex conical implants. And in the last part, we discuss some clinical cases. In the whole family of Cortex implants, we have one part that is the conical implants. When we talk about conical implants, we have to know about the types of connections. We have in general three types of connections. The first one is the external hexagonal connection. The second one is the internal hexagonal connection. And the third one is the conical connection. What's the difference between these different connections? In the group of flap-to-flap interfaces, like the external hexagon and internal hexagon, we have this kind of behavior. During the lateral forces, there is one space or one gap between the implant and the abutment. Instead of this situation, in the group of conical connection, we have a more stable connection. With the lateral forces, you have a minimum or in some situations no gap in this part, in the connection between the abutment and the implant. So they are better for many clinical situations. In the group of flap-to-flap interfaces, we have a distribution of the force next to the cortical bone. Instead of this, in the conical connection, we have an even distribution of the lower, far away from the cortical bone. When we review the literature about this topic, we found that there is an association between bacterial penetration into the implant abutment interface with crestal bone loss. With conical connections, we see superior behavior, showing lower peri-implant bone loss. In the conical connections, we have better zero, better torque and abutment stability because the connection is more stable. In the Cortex conical connection implants, we have a mixed connection. It's a mixture of a conical connection with a geometrical defined connection. In the Cortex conical implants, they add an hexagon at the end of the conical connection. So it's easier to do the prosthetic part for implant restorations. Also, in the conical connection, all the implants, they have platform switching. In platform switching implants, we have a space for the soft tissue, in the space where the abutment connects with the implant, there is some space here for the soft tissue. So the soft tissue is wider in this area and is also more stable. In the flap-to-flap implants or interfaces, we have a gap here next to the crestal bone. And this reaction of these bacteria that can accumulate in this area can affect the crestal bone. In the situation when we have platform switching, this bacteria or this reaction in this interface is far away from the crestal bone. So probably you will have a better crestal bone in this area when you get platform switching implants. We see in the literature that the crestal bone stability is influenced by a conical connection implant and also implants with platform switching. I mean, when you have conical connection, you have a more stable connection, and also actually when you add some platform switching in this area, like I showed you before, the behavior of the crestal bone is better because this connection is far away from the crestal bone. In cortex, we have two different geometries of implant. We have the classic one and the dynamics one. They are quite of different implants, and the indication are also different. When we talk about classic implant, we have an implant with a shallow thread depth. I mean, this implant is easier for implant insertion in hard bone because the thread is not so aggressive. For the dynamics implant, we have a greater thread, and maybe this is some advantage in areas with softer bone, like the maxilla. In this study from Paolo Trisi and collaborators, we can see that the dynamics implants in soft bone works very, very good. And for hard bone, the behavior or the dynamics and classic implant is almost the same. But remember that it's easier to insert a classic implant in a hard bone. That's the reason why we recommend classic implants for a hard bone, like in mandible, some cases in the posterior mandibular, and also in the anterior one when we have hard bone. Actually, these dynamics implants, they have a very nice bone condensation effect. For the maxilla or for some kind of soft bone, they work very good because this effect can improve the bone quality around this implant. Also, the dynamics implant is very good implant for this kind of soft bone because, look, when you insert the implant, they are a compressive implant against the bone, and you can get more primary stability. You can use conical implants even with freehand insertion or freehand drilling, or you can use the excellent system of guide surgery from cortex implant. When we use this kind of implant in soft and medium bone, I recommend the regular drilling protocol. But when you find hard bone, I recommend to use the next drill in order to have a better and easier insertion of this implant. When we compare hexagon implant with conical implant, we have to know that for conical implants, we have to insert the implant in a deeper position. This is also because when you have platform switched implants, the prosthetic part is narrower. So in order to have the final contour, you need more space to recreate this final contour. If you see these cases with conical implants, you see that the bone around implant is very stable. That's because the conical connection and also the platform switching. Also in the posterior regions, you can see that the bone is very stable around the implant, the connection between the implant and the abutment. Also in this case, when you have a bridge from the insertion of the implant, even through the impression time and the final restoration, you see that the bone is very stable. Also in this case, when you can see also that the bone grows over the connection, that's because you use a subcrestal protocol when you insert the implant, and the connection is also very stable. So with this type of implant, you look for bone stability and you will get it. In the cortex conical connection implants, you will find a 3.0 implant, the narrow connection. You will have also the 3.3 implant, 3.8 implant, and 4.2 implant with the same connection, regular connection. And you have also Y connection, 5.0 and 6.0 implants. I only use the 5.0 implants. I have no experience with the wider implant, 6.0 implant. For the first group, the 3.0 implant, the narrow platform implant, you have to know some considerations. The first one is to analyze the fatigue test of this implant. When you see the fatigue test, you see that the maximum resistance of this implant is around 200 newtons. When you see the functional load of the teeth, you see that the incisors, they receive a functional load around 100 newtons. For premolar, it's around 300 newtons. And for molar, it's almost around 700 newtons. So when I use an implant like the narrow implant that resists only 200 newtons, it's an implant that is not indicated for the premolar area, because in the premolar area you will have loads around 300 newtons. When we analyze the systematic review about this topic, we see that narrow implants are well documented only for single tooth restoration in areas with no load-bearing regions, like upper lateral incisors and lower incisors. So the indication for this implant is only for single restoration in upper lateral incisors and lower incisors. You will see here a video with the surgery in the lower incisor area, when you can see the drilling protocols and also the insertion of the implant. In this case, we make an atraumatic extraction of this tooth, with internal resorption. We clean the socket and we use only the starter drill for the first time, and then we use the pilot drill, only the pilot drill, and we insert with this preparation a 3.0 dynamics conical implant. So you can see in this video how small is the implant and how it's well indicated for this area when the teeth are so small. We are going to see different cases using the 3.0 narrow implant. This is an upper lateral incisor. I make the insertion of the implant. Then I management the soft tissue with the connective tissue graft. And this is after the surgery. This is the response of the soft tissue around this implant. And this is the final restoration for a lateral incisor. Also in this case, in the lower incisor, we insert the implant 3.0 with a connective tissue graft here in this area. And after the healing time, we have the final restoration, and you can see the nice response of the soft tissue. Also, in the lateral incisors, the upper lateral incisors area, you have some anatomic situations. Actually, when you have agenesia of this teeth, the inclination of the root sometimes is difficult to insert the implant. You can see here the shape of this root, very difficult. We insert this 3.0 implant in this situation. It's an upper lateral incisor. This is after the surgery. This is the provisional restoration, and this is the final restoration. So it's an implant that works very good for upper lateral incisors and lower incisors. The next group is the regular platform. You have three different sizes of implants with the same platform: the 3.3, the 3.8, and 4.2 diameter of this implant. When you see the fatigue test of this implant, you can see that with the 3.3 implant, you will get almost around 400 newtons, 360 newtons. When you remember the load that received each group of teeth, you can see that actually you can use this implant, the 3.3, for premolars with no problem. So this implant is well indicated for incisors, the 3.3 for incisors, and also for the premolar area. The 3.8 millimeters is well indicated for anterior tear and also for premolars. And the 4.2 millimeters is also indicated for premolars and for the molar regions. Also, this has a very nice resistances, so it's able to receive the load in the molar area. So now we are going to see some clinical cases. This is a case. where we want to replace this tooth. We make surgery, we open the flap, we use guide surgery to do the drilling and also the insertion of the implant. We insert a conical connection implant in this area. You can see how it works and how stable is this type of dynamics implant in the upper maxilla. Subcrestal position is very important for this type of implant, for the prosthetic and also for the platform switching behavior. We use in this implant, we did immediate loading with the provisional crown, and also we use a little bit of bone regeneration in the vocal side. And after the surgery, we have this result. This is the provisional restoration. This is the soft tissue after the healing time. This was the final result for the soft tissue, and this is the final restoration for this case. So works very nice, this type of implant. This is a very top case. This is a young lady with the agenesia of this teeth. In this case, we open a flap, we insert the implant, and we did also bone regeneration. After the healing, we uncovered the implants and we made a soft tissue graft in the vocal side. Also, we start to improve the soft tissue using the provisional restoration. We press the area, we contour the soft tissue with the provisional restoration. This is the final result of the soft tissue after conditioning. So at that time, the patient is ready for the final restoration. In this case, we use a regular protocol for the impression and also for the restoration. For the conical implant, if you use a regular protocol, you can use an open try coping or a closed try coping. You have available the different techniques for impression. In this case, we do a regular impression, trying to capture the soft tissue with this Dura-Line material. And we use a regular protocol using a regular abutments. You have abutments available in different sizes and shapes. And we use for the final restoration lithium disilicate from GC, and the master dental technician is Suhei Barona from this city. And this is the final restoration for this case, very nice case with the final restoration and a happy patient with this result using conical implant from Cortex implants. Actually, in some cases, you can also use the digital protocols for impression and to do the final restoration. When you use digital protocol in this type of implant, you have available the more famous protocols like the 3-shape one, the Exocad, and also the CEREC from Sirona protocol. You can find all the parts and all the libraries to use digital protocols with this type of implant. This is a case where we use a surgical guide to do this molar. We are going to use a 4.2 platform implant in the posterior area. to replace a molar. We insert the implant, we do some bone graft, and after the healing, we make the digital impression using the components for this protocol. We got the image from our intraoral scanner. It works very nice. This is scanning the patient, and this is designing the final restoration using exocad. So you can use the digital protocols with and you can get also very nice result with this type of new digital dentistry applied to the dental implants. After the design and the milling, this is a monolithic zirconia crown, and this is the crown, the final result with the crown on the implant. The last group of conical implant from Cortex is the wide platform implants. Here you can see the indication for this implant. This implant is indicated for molar, or replace the molars in the posterior regions. And here you can find the case. When we open the flap, we make the drilling protocol, we insert the implant, and after the healing time, look how nice the bone is around this implant. After the healing time, we start the prosthetic part of this implant. In this case, we use the CEREC protocol, the CEREC scanner, and also the CEREC software to design this zirconia final crown, and this is the result for this patient. To use the implant in different regions, remember, 3.0 platform only for lateral incisors and lower incisors. The 3.3 millimeters regular implants, you can use it, remember the fatigue test, you can use this implant actually also in the premolar area. The 3.8 millimeters, you can use it in almost every region. And the 4.2 millimeters, you can use it in the molars area. And for the wider platform, you can use in the molar region. It works very good in this part of the mouth. This is my family. We live in Medellin, in Colombia. In this moment, we have a very hard situation with the coronavirus in my country. But we are receiving a lot of vaccines from China, so probably in a few months we can get better. I hope everything will be better in a few months. I also remember your country. I went 2 times there to teach and to share knowledge with the nice people. I hope to go back to China as soon as possible for us, and also to share some knowledge, some cases, and to get a nice time with you. If you have any question, this is my social media, and also this is my email. You can contact me, or actually through Cortex dealer, you can also contact me. Anything you need, I'll be able to answer the question and to help you. Thank you, and I hope you have enjoyed this presentation, and like I say, I hope to see you soon. Bye-bye.